Welcome students. Now this is the second part of the hospital admission and ward management services. I myself Dr. Partho Sarathy Roy. Now in this video we are going to discuss what are the next steps we are going to perform or we are going to follow during the admission of the patient. So after taking the detailed history of the patient, his or her medical history and any type of allergic history, now we are moving to the next part. In this part, we have to take the patient to the proper ward as directed by the medical officer, either in the emergency ward or in the general ward. In the emergency or in the general ward or in the intensive care unit, wherever the patient goes, now the duties of the nursing staffs starts. Here, the nursing staffs has to assess the patient's condition within 1 hour. This time is very crucial because if you cannot assess the patient's health within the minimum time, the treatment procedure will be delayed. In this part, the nursing staff first looks for a few vital parameters. Those are number 1, blood pressure. It is very important to know. Number 2, pulse rate, that is the heart rate. Number 3, the respiration rate, RR, respiration rate. Number 4, his CBG, that is complete blood glucose. Number 5, his general postures, that is whether the patient can talk or he can sit or not, he is conscious or subconscious or unconscious, like that. Number 6, it is very important, his or her heartbeat and respiratory sound, that is the breath sound. And if the patient has been suffering from some type of pain, then a assessment of pain scoring is important. In the note provided along with this video, you can find a topic, that is pain scoring. Pain scoring is a scale. Actually it is a number from 1 to 10, where by following some specific criteria, the nurse can assess what the intensity of the pain the patient is suffering from. So the pain scoring is very much important. If the pain score becomes 7 plus or 8 plus, then it means it is very much severe and the patient may develop neurogenic or psychogenic shock due to this type of pain. Now, after assessing this type of vital parameters, we have to look for some other things here. Those are what I have stated in my previous video, that if there is any history of allergy, it should be, or better to say it must be, taken into consideration again. That is to say, the nurse will further inquire to the patient whether he or she is known allergic to some particular foods like brinjal, like egg, like prawns, etc. or not. After assessing this type of vitals, this data is recorded and then handed over to the doctors. Okay. Now, here the question comes, then what are the main functions of an inpatient? Very briefly, the functions of inpatients are, number 1, to provide proper medications, drugs and life-saving support to the patient. Number 2, arrange for the duty doctor and specialized doctors to see the patient and give their proper valuable opinions. Number 3, it provides necessary life supports, that is the ventilators or BiPAPs or different types of life supports which are used in the hospital segment, like ventilators, like BiPAPs, like oxygen masks, like different types of life-saving injections like adrenaline, noradrenaline, dopamine, etc. And number 4, it is also important, that is the training purpose. There are there are trainee nurses present out there in the hospital, there are trainee doctors. They also serves to the patient, also learns from the patient condition, patient's deteriorated health, how to treat and how to handle this type of patients in future. Now our next point is, how many types of wards are there? There are chiefly two types of wards present in the hospital. Number one, general wards. In general wards, we treat the general type of patients. General type of patients means the patients who doesn't require any special type of medical attentions. Say a patient is suffering from loose motion and vomiting, that is acute gastroenteritis, or a patient is suffering from a course of fever. So in these cases, the patient is admitted to the general ward. And another type of ward is specialized ward. In specialized wards, those patients are admitted who requires special medical attention provided by specialist doctors like cardiologists, like endocrinologists, like pulmonologists or gastroenterologists. So these two type of medical wards usually serves the purpose, and in our next video we are going to discuss the different types of orientation of the wards, the facility provided and the setup. Thank you.